Obey. And this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old. To grow old in good health, welcome to our show. Well, we're here again today, and we are going to talk about a topic that deals with getting pregnant. And we have a physician here that's going to talk about that particular topic from A to Z. Before we start there, we're going to do my favorite thing, and that is sharing and caring. Sharing and caring. Make sure that we share and we care for each other. It's so important. And I stress this every show, because if we just take a moment and look at a neighbor or a family member that may need to go to the doctor, or even just to go out to the park because it's a sunny day, and you can take them out and assist them there so that they can get some sunshine. It's so important that we take care of each other. And also those med moments, don't forget about that. That pain in your chest, or that headache, or that nosebleed that comes on and unexpected. Go see your doctor. Those are med moments. Those are moments that your body's telling you you should see your doctor. Well, let's talk. And remember last show I said that we were going to do 2 shows on smoking. And this is the second show. I just want to highlight some of the things, medical reasons why you should quit smoking. Well, let's talk about a few of them. Cigarette smoke, the number 1 cause of preventable premature disability, disease, and death in the United States. The number 1. 4 of 5 leading causes of death are related to cigarette smoking. Cigarette smoking is responsible for 30% of all cancer deaths and 20% of heart disease deaths. Things like emphysema as well as bronchitis are associated with cigarette smoking as well. Nearly 90% of all lung cancer deaths are caused by cigarette smoking. Smoking is a major cause of, as I said, COPD, all right? And that encompasses emphysema as well as bronchitis, okay? Nicotine restricts the blood flow from mothers to the fetus and reduces the oxygen level in the unborn child. Very important. So if you're pregnant, do not smoke, okay? Children of smokers develop more allergies and more upper respiratory tract infections than other children that are in a household that there's no smoke, okay? Secondhand smoke. Understand that if your partner smokes or if your mom smokes, then you are subject to many of the problems that they may get, you may get as well, because you're exposed to that secondhand smoke. Women smokers double their risk of cervical cancer. But this is a list of reasons why you should stop smoking. So think about it, guys. Throw those cigarettes away. All right, that's enough of that. What I want to talk about today is preparing for pregnancy. And I have the perfect physician to talk about this particular topic. His name is Dr. Edsel Antonio, and he's an OBGYN physician. Dr. Antonio, welcome to our show.
Thank you for having me.
All righty. Well, the thing of it is that I know preparing for pregnancy, it's called preconceptional care. All righty. And that's a tongue twister for me. But explain this for me. Explain what we're talking about as far as this is concerned.
Okay. So, I mean, it's pretty much, to simplify it, is what the topic is. It's preparing for pregnancy. Mm-hmm. There are a lot of preventable things that women can do to optimize and make the pregnancy a healthy pregnancy for themselves as well as for the baby. Mm-hmm. Unfortunately, a lot of pregnancies are unintended or they're not planned. Okay. So it's good to be able to reach out to women when they see their gynecologist to prepare, to know that if they're planning on getting pregnant, there are things that they could do to change their lifestyle, change their habits, to make the pregnancy a safe one for both her and the,
For both mother and
baby. Correct.
the baby.
Yes.
All right. Let's look at this. I was reading something, and you said something about unintended or unexpected pregnancies. I was reading something that it's as high as like 50%. Is it really that high?
Yeah, it is.
My goodness.
It's it's not necessarily, you know, a lot of women, you know, they don't plan these things. And it's just the course of, that's reality.
That's reality, huh? Now, the most important thing is that if you're not planning on getting pregnant, obviously you're not thinking, I got to be healthy, I got to be healthy, I got to be healthy. What are some of the things that you can do just knowing that there's a possibility that you can kind of protect yourself just in case it happens?
So, I mean, there's, you know, women just need to be aware of their lifestyle.
Okay.
The thing with that is that if they are in a reproductive age and they're, you know, having unprotected sex, there is a chance of getting pregnant. So little things they could do is they could take prenatal vitamins. If they're, you know, those are things. If you're not taking contraception, birth control, you should take a prenatal vitamin. It's not necessarily specific to pregnancy. It's, you know, just a multivitamin with certain things in it that would help in the event that they do get pregnant.
Okay. Now, let's step back just for a minute and let's just go to another category here.
All right.
I know that these are unintended pregnancies. What can you do? What are some of the ways that you can protect yourself? You know, just to give a general understanding, because we should hit both sides of the trail, I think.
Protect yourself from getting pregnant.
From getting pregnant.
Well, again, it's just knowing your lifestyle. And if you're having unprotected sex, there are simple things like birth control pills, barrier methods such as using condoms, abstinence.
Right. You know, that works too.
there's a whole bunch of things, and you know there are other instrumentation and I guess medications that you could take that can help you to prevent that can you know facilitate your lifestyle of not getting pregnant.
Okay, all righty. So now that you're a couple now.
Okay.
All righty, and you know you're thinking about getting pregnant. What's the first thing you should do?
Okay. Well, if you're thinking of getting pregnant, the easiest thing to do is to start taking the prenatal vitamins. The other thing is to know if you have any existing conditions, such as diabetes, high blood pressure, asthma, things like that. Okay. Just pretty much your medical status.
Okay. Should you go to your doctor and say, hey, guess what? We're thinking about getting pregnant. My husband and I, you know, we've been together for 5 years now, and it's about time. How should we go about this? Should that be a routine?
Yes, it should, because those are the things. You know, the preconceptional part of it is just to optimize before the pregnancy. Besides the vitamins and just addressing the coexisting medical conditions that you may or may not have, such as the high blood pressure. The thing is, when you have when you have certain things like diabetes, hypertension, you may be taking medications that may be harmful to the baby. So you may have to adjust that. You may have to change your medications as well. Okay. Things like that. Those are one of the...
Yeah. When you see patients in your office, and for the first time, if you've seen a patient and you know they're trying to get pregnant or whatever, are there certain bloods that you have to draw, or are there certain profiles that you want to see as a doctor to make sure that this patient is going to be able to conceive?
Yeah. To be able to conceive.
Well, maybe that's the wrong one. But get pregnant.
Well, yeah. I mean, when I guess the thing is we look at just the blood work, the hemoglobin, if they're anemic.
Right. Things like that.
There's the things, because you know pregnancy can induce anemia, make it worse. Okay. So those are things. You know, those are other things that you can do to prevent that. Maybe take iron supplements to help boost up the blood. Okay.
All righty. Now you had mentioned, you know, like knowing your body, and should a female know their cycle so they know when they're best time to, you know what I mean, have intercourse with their husband or whoever to try to get pregnant?
Yeah, I mean, surprisingly, a lot of women are very aware of
Okay.
when they can get pregnant, when they're
Okay.
ovulating in the middle of their cycle.
Okay.
So those are things that they already know, and
Okay.
it's it's not too bad. The thing that they should, I guess, when they come for the counseling session is how regular is their cycles.
Okay.
Because there are certain things that when we try to date the pregnancy to see how far along they are,
Right.
it may not be as accurate because their cycles may be irregular.
Okay.
They may get it once a month and not get it the next month, or they may get it twice in that month. So it helps to know if their cycles are regular, and also for trying to conceive as well, just to
Okay.
optimize that.
Alrighty. Now, the thing of it is that you said that other disease entities that may affect someone trying to get pregnant, like high blood pressure. Alrighty. I know within just the general medical, high blood pressure affects so many things. Now, does it are the same that high blood pressure, does it affect the uterus as far as the ability of the patient to get pregnant, or is it you know what I mean, does it make it harder or something?
Yeah, I mean,
trying to explain,
if they have pre-existing like high blood pressure, it could affect the pregnancy in terms of the viability of the pregnancy.
Oh, all right.
If
now viability, you mean whether they would lose the pregnancy?
Would they lose the pregnancy?
During
yes.
the okay.
Because as with anything, you need a good blood supply, blood flow, and
Right.
especially to the baby, and especially in the early weeks of pregnancy. That's when it's critical.
Okay.
So if they're not optimized, if their blood pressure is high and uncontrolled, it can affect that blood getting to the baby.
Okay.
And it could lead to miscarriages.
Okay. All right. What about diabetes? I know diabetes affects everything, and it affects your eyes, it affects your kidneys, it affects your heart, it affects pregnancy as well.
Yes, it does.
Okay.
The thing is, when we talk about preconceptional counseling for women who are already diabetic,
Right.
we would want them to have their blood sugar controlled.
Okay. So you mean keep it in a good range at all times?
At all times.
You don't
correct.
want that up and down, jumping like I ate a meal and boy, it's 300, it's 400, and then I get it back down. You
Correct.
want it, even after eating, you still want it in a decent range.
Yes. And I mean that the big thing is that it affects the baby.
Okay.
Especially early on, the most common effect, I guess, anatomical effects that can affect the baby are cardiac conditions to the fetus.
You mean heart
conditions? Yes, to the baby, and there could be some cardiac anomalies that are I guess diabetic women that are pregnant can have, their babies can have.
Okay, so if you have diabetes, what you're saying is that there's a higher chance of the baby actually having an abnormal heart condition.
Correct, yes.
All right, just because the mom had diabetes, especially if it's out of control.
Yes.
All right.
Especially if it's out of control.
All righty. Now, if the mom has heart disease, does that complicate the pregnancy? Because, as you get pregnant and as the stomach, gets larger, it presses up. Does that really complicate things?
Yeah, it does. I mean, that's another thing too. Maybe not early in the pregnancy. Now, when you get pregnant, the thing is you take in water, your fluids, the fluid in your blood is much more, so that can affect the way the heart works.
Okay.
It could overtax the heart. It could
Okay.
overwork the heart, and then later on in pregnancy, when you have to think of the delivery.
Okay.
If a vaginal delivery where you're pushing a lot, if that's healthy for the heart, if it's healthy to the mom, or if the other option would be like surgical option. So it's heart disease in pregnant women is a very high risk pregnancy.
Alrighty, and I'm sure like things like asthma, where the oxygen in the blood decreases. If the mom is having an asthma attack,
Yes.
then obviously it's going to affect the baby. It's
Yes.
going to affect the uterus and things like that as
Correct.
well.
Yeah, same,
All right.
same thing with that.
What about HIV? It's a big issue. All right, and do patients with HIV? I understand that there's a lot with the new meds now.
Yeah.
The viral loads are non-existent most of the time. So the likelihood that the baby will have HIV is very low to nil. You
Yes.
know, it's very unlikely if the patient's taking their medications. Is that an issue as far as and I don't want to, you know, say too much about this,
Yeah.
but tell me about that issue, because there are some patients I'm sure out there that would be worried about this.
Yeah. So I mean, if they already know that they have HIV, it'd be good to know things like their viral load and things like their CD4 count. And women with HIV would be aware of this.
Right.
What medications they're taking again, and pretty much during the pregnancy to maintain that. And it's good. It's the thing with women like that with HIV. It's good to have the regular routine prenatal visits.
Okay.
And just working along with their infectious disease doctor or whoever's managing their medications.
Right.
To just make sure that that they're compliant with their medications, they're taking their medications, and then just the plan when they're planning to deliver, how they're going to deliver, things like that.
Yeah, because I'm just thinking about that 50% that we're talking about. I mean, you know, we all are subject to different ailments and
Yes.
different diseases. I mean, nobody gets away with, you know, nobody has a pass card. I'm
Yes,
sorry,
yes,
it just
yes.
doesn't
You're
happen.
right.
So we all are subject to something. And so you want to have a safe pregnancy, and you want to be able to get pregnant if you want to. But then there's that big 50% that are that become pregnant that we're not intending to be pregnant.
Yes.
And that's the group that's so amazing to me. It's just amazing. Let's talk about other things. Let's talk about you were talking about lifestyle. And you should know your lifestyle. What about smoking? You know, I'm on a big smoking campaign now, so
Yes.
we got to talk about smoking.
So I mean, I'm sure you're very aware of it. You know, you know, smoking is bad for your health in general. That's
That is
you know,
true.
easy said. But you know, for pregnancy as well, women who smoke, they are prone to preterm delivery, delivering their baby prematurely,
Okay.
as well as other things to their own health. And you know, just with what you're saying about the diaphragm lifting and their oxygen intake could be compromised.
Right.
So there's that with the smoking as well.
Alrighty.
And
Go
it's
ahead.
very hard. You know, unfortunately, it's hard for women who do smoke and they find out they're pregnant to just quit like that. So just being aggressive with at least trying to cut down on how much they're taking in and stuff like that is a start.
It helps.
Yes, it does.
Alrighty, all right. The big alcohol, you know, it's Saturday night and everybody's all right. We're going out to have some drinks. Tell me about alcohol and pregnancy.
Okay, so I mean, that's a big thing for preconceptional counseling. You know, if, like going back to lifestyle again, if they drink socially and they are intending to get pregnant, they should not drink.
Right.
There are certain syndromes that the baby can develop from women who drink, and I mean, those are things you want to try to avoid. Those one of the things such as smoking, such as alcohol, and the other thing would be illicit drug use as well.
Right. Now the next question I want to ask you is something that is really high on my list.
Okay.
And it deals with obesity and weight loss, because I truly feel that if we could get people to lose weight, if you could be the appropriate weight for your height, I feel that it could bring down diabetes, hypertension, heart disease, colon cancer. It's just kidney disease. It just across the board.
Yes.
With pregnancy, is obesity a problem as well?
Definitely.
All right.
The same thing with obesity. You're prone to miscarriages. They're prone to developing things that you would, even if you're healthy, if you don't have high blood pressure, if you don't have diabetes, you're prone to developing diabetes in pregnancy or high blood pressure in pregnancy, as well as, again, premature deliveries or even complications during the delivery itself. It may it may the obese pregnant patient may have a difficult time delivering vaginally, and then the other option would be to deliver through surgery, through a C-section, and that carries its complications, surgery with women who are obese.
Yeah, yeah. So you're telling me that before you're pregnant, you may not have high blood pressure, and you may not have diabetes.
Correct.
But once you're pregnant, then that may develop during the pregnancy?
Yes, and you don't have to be obese. That you can develop that if you are a normal, you're normal weight. So then those are the things that come with pregnancy. There are age populations that are more prone to it than others, but yeah.
Okay. So what you're saying, you just opened Pandora's box. Yeah. So you're saying that if you're older,
yes,
then it's more likely to happen than if you're, young.
Yeah. Well, I mean, no, the younger population, they're prone to developing the high blood pressure in pregnancy.
Okay.
And the older women are, they have also the high blood pressure as well as the diabetes.
Okay. What about your GYN history or your OB history?
Yes.
I should say OB history as opposed to GYN, obstetrical history. Does that play a part as far as you getting pregnant? Meaning that, have you been pregnant before, or did you have a complicated pregnancy before? Does that play any role as to this pregnancy or the likelihood of me getting pregnant again?
Yes. I mean, so again, it gets back to knowing your body and knowing your history, especially your obstetric history. If you've had children before who were delivered early, there might be some underlying condition to why they're delivering early, and that makes them a risk factor for this current pregnancy to deliver early as well, to deliver prematurely, to try just to make sure that they don't deliver too early or even have a miscarriage because of their history in delivering babies early.
Okay.
Another thing is surgical history. Women who have had multiple abdominal surgeries or in this case for cesarean sections.
Right.
They're at risk for developing other complications later on in pregnancy. Where it could be life-threatening. As you know, multiple surgeries carries the risk in itself, and continuing that, those are things that you would counsel one of my pregnant patients on. You understand the risks of having a third or even a fourth cesarean section. Right. So
it actually weakens the uterus to a certain degree, you think?
Yeah, I mean, continually cutting the uterus makes the muscles weak, and those are weak points where things like uterine rupture can happen, and that could be life-threatening not only to the baby but to the mother as well.
Okay, all right. Let's talk about this prenatal vitamins. That's a big issue, I understand. Now, there's one particular element in the prenatal vitamin that's called folate or folic acid.
Correct.
All righty. And tell me about that as far as the baby is developing. It's so important.
So remember in the beginning of this topic, we were talking about, if you're not getting pregnant, if you're not taking any birth control and you're having unprotected sex, the simple thing to do is to take prenatal vitamins.
Right. Okay.
The thing is, one of the things in it is folic acid.
Okay.
The reason why we try to have them take it before they get pregnant is because when women actually find out they're pregnant, it's actually past the window of opportunity for that folic acid to work.
Oh.
Yeah. So it's, usually the development of the brain and the spinal cord is early on in pregnancy, within the first trimester. Usually by the 8th or 9th week, most of the organs are already developed, and that's the critical time. But the thing is, women don't find out they're pregnant until they're maybe 7, 8, 9 weeks, and so it's very critical that they get the proper supplementation.
So you may not have symptoms, or you may you may continue to have your menstrual, is what you're saying, or you may
yeah.
have, or you may not have symptoms like morning sickness or anything
Yeah,
until
I mean,
like
some women don't.
quite a few weeks down the road.
Correct. Yes, some women don't know until they miss their period, and by that time, it's already past that window of opportunity. Or they may think they've gotten their period because they have spotted, or they had some light vaginal bleeding, and they thought that's it. But then,
Interesting.
yeah.
Interesting. Well, tell me, who are usually likely to come to your office for prenatal or pre-pregnancy counseling? What are the most common? Is it the married couple, or is it older couples, or who are usually coming to your office to see you?
So, going back to it, most of these women are already pregnant.
So they know something's wrong, Doc.
I mean, it's good.
Help out here.
I mean, it's good. Yes, it's good to get the word out. It's good to educate the women out there who are to try to seek care before they get pregnant. But any range of women, from the young to the older reproductive age women, they come seeing it. But like I said, most of them are already pregnant.
So when they come,
it's good to have. It's good. You're lucky to see them if they come to you beforehand.
Right. So that's what we're trying to do. We're trying to educate, basically to let everybody know that they should make this visit prior to, and stay healthy and try to keep yourself, definitely if you're within the range of childbearing age, you should really try to keep yourself as healthy as possible if you're out there, having unprotected sex. Okay, excellent. Listen, we have come to the end of the show. We have run out of time. There were quite a few other questions I had to ask you, but I'm just so glad you took time out of your busy schedule to come and tell us about this particular topic.
This is stuff that that needs to get out there.
All righty. Thank you very much. Thank you.
Thank you so much.
All righty. Well, in closing, all righty, guys. Remember, sharing and caring. Let's take care of each other out there. All righty. Let's just pay attention to those med moments. Let's take care of each other. Let's share our medical knowledge. And hey, all you young ladies out there, and little older ladies, take your husbands to the doctor tomorrow. Let those guys know that they need a physical exam as well. All righty. Never institute any change in your medical care until you see your physician. I trust each and every one of you continue good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.